We have just published our annual report looking at the state of healthcare and social care in England. It's a look back at the year 2009 to the end of March 2010. The report tells us that there has been improvement in both health services and social care in England. And that's very good news. It reflects the very hard work of many dedicated staff who work extraordinarily hard to ensure that everyone who experiences social care and health services gets a really, really good service. Let me tell you about some of the things where we've seen improvement. Well, we know that when it comes to healthcare acquired infection, the improvement there has been significant. And patients too have told us that they've noticed that in hospital the wards are much cleaner than they had reported previously. We know too that a considerable number of people are having personal budgets and able to exercise more choice and control about the service that they receive. There are, however, things that need to improve. What I'm talking about is not a consistent picture. Some places are doing extraordinarily well, but in other places there's need for improvement. And I just want to mention a couple of things which certainly are highlighted in the report. First of all, information. A third of people who leave hospital believe that the information they have is not sufficient for them to understand about taking their medication or what's going to happen when they get home. We know too that increasingly people who approach the local authority for help are being signposted to other organisations. But what we don't know is what happens then. So carers and people who are looking for services are being left, in our view, with inadequate information. Since the end of the period that the report was looking at, the Care Quality Commission has been operating under new legislation, the Health and Social Care Act of 2008. This means that we register hospitals, both NHS hospitals and hospitals in the independent sector. And we also register those organisations that provide adult social care services, whether in a residential home, a nursing home, or in your own home. And we're currently registering dentists. And through that registration process, we expect those services to meet 16 essential standards. And we monitor how activities and services measure up to those standards. And if we've got concerns, it may well lead to an inspection, and if necessary, we will apply conditions and ask that changes are made. And if they're not, we may have to take further action. But the most important thing is that we and those who provide services absolutely keep their eye on quality and the experience that people have through not only this turbulent time of change, but on an ongoing basis.